Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and we're here again on Monday at 9 p.m. Eastern Standard Time to answer your questions live. I'm a psychiatric nurse practitioner who's worked in the field of maternal health for almost 15 years now. Remember, please like and subscribe to the channel. Subscribing to the channel really helps me out as a content creator. Also, remember, we're on Facebook and Instagram for additional content. Those are usually linked in the description below. And we have videos for you guys. So we did some filming this weekend, and we do have a video coming out tomorrow. And for those of you guys who stick it out to the very end, I'll give you a sneak peek at tomorrow's video. So as you guys are coming in, remember, please put your questions into the chat. That's part of the reason why I'm here. But I always go ahead and I start with some of the questions that we got on the videos, and please just feel free to put anything in. So I actually got 3 questions on my antibiotics video, so I think I'm going to start there. So the first question said, I'm 4 weeks pregnant and terrified because I was told metronidazole can cause spontaneous miscarriage in the first trimester. I want to treat my bacterial vaginosis to avoid other complications, but I don't want to lose my baby. So antibiotics are extremely important during a pregnancy. Almost every woman will face a bacterial infection during her pregnancy and will be given antibiotics of some kind. Remember, antibiotics treat bacteria. They do not treat viruses. This is why we don't give you an antibiotic for the common cold. They also don't treat funguses or yeast or anything like that. So when you when you're pregnant, you are immunocompromised. Your immune system is kind of tamped down because if it was at full-fledged capacity, it would basically potentially look at your pregnancy like a foreign body, and it would try to attack it. So the immune system naturally kind of calms down during pregnancy, and this makes you immunocompromised. This is why we encourage you to get the flu vaccine and the COVID vaccine, because you're at higher risk for not only contracting infections, but also getting a more severe form of an infection. So women also tend to get sick while they're pregnant. Now, there's a lot of different things that you can get, and one of them are sexually transmitted diseases, a lot of which are bacterial. And then you can also get urinary tract infections, which are treated with antibiotics, and then stuff like BV. So BV, bacterial vaginosis, is actually not a sexually transmitted disease, and it is treated with antibiotics. The most common antibiotic we use is metronidazole. In fact, it's extremely effective for BV. But there's a lot of information out there that talks about this miscarriage risk. Metronidazole, I have seen it used time and time again during pregnancy. When you look at the sources, there is no source to say that that's actually a risk. There's not also any sources that talk about any kind of birth defects or anything like that. So we do use metronidazole a lot. Now, where am I getting this information from? Because that's important. Part of the reason why you guys ask me is I'm like a second opinion. If you've already gotten the prescription, I'm a second opinion for you. So we all look, all your healthcare providers, we're all using some kind of database or more than one database or data source in order to determine the safety of medications. You can't test medications on pregnant women or breastfeeding women. It is not ethical. So as a result, we have to aggregate data from different sources. So I use my sources from Thomas Hale, who's a pharmacist who's aggregated a lot of different information. He has brought together half-life and molecule size and safety profile in non-pregnant people. He's also brought together animal studies and anecdotal evidence that's been gathered from women who have taken these drugs while they were pregnant. And he's put this all together and created a risk scale. And metronidazole falls into the probably safe category. It's still a risk versus benefits. And every time you're being prescribed a medication, you want to talk about risk versus benefits. In fact, the other thing I recommend for women of childbearing age is you should actually be talking risk versus benefits of medications before you're even pregnant. So I'm in psychiatry, and every day I have women coming to me for medication for a variety of different things, including ADHD, insomnia, anxiety, and depression. And every time that I am talking to a woman of childbearing age, I find out what birth control they're taking, and then I tell them the risk versus benefit of the medication that I'm recommending. Because some of the medications that I prescribe are fine for pregnancy, and some of them are not. And if a woman chooses to take a medication, she should know whether it would be safe if she was to accidentally get pregnant. So when you're in this age, it's important not only when you're pregnant, but before and after you're pregnant to know the safety profile. Now, if you were to take an antibiotic, it's extremely important you take all of it. You need to take the entire course, because a lot of people like to take the bare minimum of medications, but you can't do that with antibiotics. You need the entire course to kill off all the bacteria. Even though after like a day or two of taking it, you're going to feel so much better, there's still bacteria in your system. And if you stop the course midway, that bacteria gets a chance to grow and it overgrows, but it also creates a defense for the bacteria you were just, for the antibiotic you were just given. And then that antibiotic is no longer as effective. A lot of people are very concerned about taking medications because of safety. But if these like infections are left untreated, they can lead to miscarriage, preterm birth, and stillbirth. That's why we need to treat them. But if you end up stopping and then restarting medication, forcing us to basically use stronger and stronger medications, the stronger the antibiotics get, the more risk there is associated with it. So that's why it's really important that you kind of look at this very carefully. So as far as going back to metronidazole, I've seen it used many times. It's a risk versus benefit, but the course for metronidazole is usually very small, and the risk of untreated BV is very large. Now, second to that, and kind of going along with it, we had another question that said, my wife is pregnant and takes Somapin antibiotics for maintenance. Is this safe? These antibiotics are for her rheumatic fever. So this is a medication, Somapin, that I'm not familiar with. So I did some research, and it's in the penicillin family. But what a lot of people don't realize is in the penicillin family, there's a whole bunch of different versions. So some of the penicillin medications are safe for pregnancy and some aren't. So in this particular case, I cannot comment specifically because we don't use that medication where I'm from. So what do? Because you're here for a second opinion. The other place you can get second opinions is from your pharmacist. So pharmacists are trained. They have specialized training in medications and medications for women who are pregnant and breastfeeding. They have access to lots of different databases that not only look up the safety profile, the risks, the side effects, but it also looks for interactions between drugs. So they are a very good resource when you are not sure about whether the medication that you are taking is safe. And that's what I would direct you to. The other thing is your doctor who's prescribing this medication should be talking to you again about risk versus benefit, because there's a lot of times that we will treat something even though the medication is a little bit more risky, because the benefit to not, or the risk to not treating is far greater than any risk to treating. So this is one that I would definitely talk to the pharmacist. Absolutely, Zane. Please put your question into the chat. The final question was, I'm 19 weeks pregnant and my doctor prescribes cephalexin 1,000 milligrams twice a day for 5 days to treat a chest infection. Is this safe? Cephalexin is another one of the antibiotics that is commonly used. A lot of the data out there doesn't show any risks. In fact, there is a study that showed when cephalexin was used to treat urinary tract infections, there was actually a reduced risk of premature births. So that is absolutely a great drug to use. We use it all the time. And so it's something that really can be used very effectively for your infections. For those of you who are joining, hi, please feel free to put your questions into the chat and I will answer them as I see them. While I'm waiting for the questions to come in, I'm going to answer another question that we had that was on water. So I have a lot of videos on formula. Okay. I'm a lactation consultant. I've been a board certified lactation consultant for 15 years. However, I'm very pro formula. I think whatever works best for a family, whatever choice they make is the choice that we should support. So I do have a lot of videos on formula and what to pick for formula, how to clean bottles, but I did this video on water for formula because there's so many different waters and nobody really knows what to use. The question was, is it safe to use distilled water for newborns age 0 to 6 months? And the answer is yes, you can use distilled water. It's most of the waters are safe. The biggest thing you guys want to avoid is any waters that add minerals because those can be very unsafe for babies. You don't want anything that's a mineral based added to it. Okay, so my wife's girlfriend is pregnant and she has been getting strange headaches lately. I've been trying to look after her since it's my first time being a father. I don't know what I'm doing. Is it normal to get these strange headaches? She's been getting blurry vision. Zane, that is not normal. This is a fantastic question. First and foremost, that sounds like preeclampsia. So preeclampsia can be a very serious life-threatening condition during pregnancy that if left untreated can actually lead to seizures and potentially something worse in mom. And of course, if mom is not doing well, the baby won't do well. Preeclampsia is a condition that's usually characterized by high blood pressure as well as usually some kind of organ failure. Usually we see it in the liver. The symptoms for that high blood pressure start with headaches, and these are headaches that don't respond to normal medication. So these are headaches that feel strange, and you take, like, say, a Tylenol or something, and they don't go away. The second symptom of preeclampsia is visual changes. This can be blurry vision. It can be spots in front of your eyes. It can be tunnel vision. It can be floaters, things that you seem to be floating in your eyes. That is the second symptom. And the third symptom is pain, and it's pain right up under your breasts. It's usually on the right-hand side, and it's kind of like this dull ache. That's kind of what people will describe. It's a dull ache on the right-hand side, upper abdomen. Sometimes it goes towards the center, and people will sometimes mistake it for acid reflux, but when you actually question them, they'll be like, well, I thought it was this, but it didn't really feel like that. That's the third symptom. You may also see with preeclampsia some swelling. Oftentimes there'll be swelling right ahead of time. And one of the things that the swelling can be is in the face. That's one of also the classic kind of preeclampsia things. Swelling in the legs could be, or it could be just normal. But if you see like swelling in the face also, that's another sign potentially of preeclampsia. Zane, for you, absolutely. You need to call your healthcare provider. If they're not available, you need to take her to a hospital so that they can check her out. What they need to do for this kind of thing is, yes, we do blood pressure, that of course. But one of the other ways we diagnose preeclampsia is actually through blood work. So we're going to look at the blood for a couple different things. And like I said, usually preeclampsia is associated with like some kind of organ failure. Now, the organ failure usually never gets to the point that the organ is never going to work again. It's usually very mild, but you see the signs. And the most common one is the liver. That's why the upper right hurts, because the upper right is where your liver is. So when we do the blood work, one of the things we're looking at is liver enzymes. And if those are elevated, that's a very strong indication that we could be dealing with preeclampsia. So I definitely, those two symptoms right there. And I'm so glad you asked. Headaches, blurry vision, it's the first thing we would all think of, all of us in the biz. So please get her checked out. Okay. Have a nice day. Okay. My question is about ureaplasma. Okay. How do you treat ureaplasma? I have a video on this. Ureaplasma is tricky, but it's usually treated with antibiotics. That's how we usually treat it. It depends on what like your doctor chooses to use, but it is a bacterial infection. So we want to treat this because actually it's not very common, and you can actually end up like with preterm labor. When we go to see you in the hospital and we're suspecting an infection, one of the things that we will do is we will swab any secretions that we have coming from the vagina. And that's often how we identify ureaplasma. And with the ureaplasma, it's very important to get treated because we just don't see it that much. Yes, Dean, I'm glad that you're going to go to see a doctor. That's very, very important. If I hope that answered your question, Seda Cat. If it didn't, please let me know. But that is a bacterial infection that's treated with antibiotics. Now let's go on. Any of you guys who have questions, please put it into the chat. I think I'm going to answer this question. I got this on my UTI video, and it said, is it a problem to have red urine? And the answer is yes. So urinary tract infections, very common during pregnancy. So you have your bladder. It's like a balloon. It stores your urine. And coming out of the bladder is your urethra. There's just one, and it comes out and it like lands right around your vagina. That's how you pee. Okay. It's below the clitoris and above the vagina. There's a little hole. That's the urethra that goes into the bladder. Now, that little hole, the urethra, is right next to your vagina, right next to your anus. So there's a lot of bacteria down there. And one of the reasons why women have to wipe from front to back, which means from clitoris towards the anus, is because if you wipe the other way, you could wipe some of the bacteria into the urethra. Then the urethra is really small. It's tiny. And so it's really easy for that bacteria to go up and then into that bladder. Now, the bladder is dark, it's warm, it's moist. It's the perfect environment for bacteria to grow. So it starts to grow in there, giving you a urinary tract infection. Now, one of the ways you can prevent urinary tract infection is by drinking lots of water and peeing a lot. But the thing is, when you're pregnant, sometimes the bladder kind of gets squished by the baby. So even if you pee regularly, some of that urine will get trapped, creating the infection. When you get a urinary tract infection, you'll usually get pain when you urinate, burning, and you'll feel like you need to pee all the time, even when you don't have pee to have. But you can also get bleeding. So bleeding is like not good, and it can cause that red like urine. Now, from the bladder, okay, we have two ureters. So the ureters are also small tubes that go into your kidneys. Now, the kidney's job is to filter blood and take out all the toxins and water that we need to pee out, and then blood circulates back into your body. When that bacteria goes from the bladder up into the kidneys, it's called pyelonephritis, or it's a kidney infection. Kidney infections are more serious. If left untreated, they can cause sepsis, which is a blood infection, which is life-threatening for mom and baby. So we definitely want to prevent that from even happening. But sometimes if your bladder infection is left untreated and it hits the kidneys, you will also see blood in the urine, which is red urine. And that is a big deal, and you need to get it checked out. I suppose that there's probably some medication or food or something that might color your urine red. I would not take that chance. You need to go and get that checked out, because I would assume that it's blood. Yes, I will tell you quick what that is again. So preeclampsia is a serious life-threatening condition characterized by high blood pressure and some kind of organ failure, usually liver. The symptoms of preeclampsia include a headache that does not go away with like normal treatment, like Tylenol or something, some kind of visual change that can be blurry vision, tunnel vision, spots in front of your eyes, or floaters, like things that float in front, and pain in your upper right abdomen. That pain is usually like dull or sore. Some people will mistake it for like acid reflux, but it's kind of different. And then you may also see swelling in the face or other parts of your body, but swelling in the face is usually like the thing. So I really want to make sure that you be very mindful of this. This is a medical emergency, and you need to basically get it checked out. You need to go to a hospital so that they can check your blood and your blood pressure and see where things are at. Okay, so I have a friend who is 2 months pregnant and they have been getting pain in their thighs when they sit down. Is it normal? Okay, so that could be normal. Okay, so you can have pain in the, okay, so when you're pregnant, you get a lot of weight in the abdomen, right? And that weight can start to press on some of the nerves. And the most common nerve is the sciatic nerve. And the sciatic nerve kind of travels down your back and then through the buttocks like this down into the legs, right? And so the sciatic nerve, if it's hit, can cause super amounts of pain for sure. And that pain can be kind of like electric, or it can be just more of like a sore. So that is possible that it could be causing that. The other thing, see, this wouldn't be thighs. We have a video on pelvic pain, and there's something called round ligament pain, which is where the uterus, what happens with the uterus is that the uterus is like in your abdomen, kind of suspended. And then you have ovaries, and they're kind of all attached using ligaments. So as your uterus gets bigger and there's a baby in there, it gets heavier, and those ligaments kind of get pulled on, and it creates this really, it can be a sharp pain. It can be like it's dull pain. It's anything, but it's probably not that. My guess is it's the sciatic nerve. But what I would tell you is, I would tell you to ask your healthcare provider to potentially like refer you to say like a physical therapist or something like that. Okay, so that's what I would say about that. Anybody who's coming in, please feel free to put your questions into the chat. Okay, I had a couple questions on like incompetent cervix. One was on one of my videos and one was on the other. So the first one was on my cerclage and bed rest video. And it said, can I return to my desk job, which is from 9 to 4, 2 weeks after a cerclage procedure? So this is a good question, and there is not a straightforward answer. So let me start by saying, what is the cerclage? Okay, you have your uterus, you have your cervix. Okay, this actually looks very much like what your cervix looks like. The cervix is long, thick, and closed. And your cervix obviously can't be solid because it needs to dilate. So this actually looks very much like what a cervix looks like. And this little opening right here, that's where your mucus plug is. So when you start to dilate, the mucus plug comes out. And that mucus plug is designed to see it to like basically like hold in, like prevent like bacteria from going up into the uterus. Okay. So what happens with a cerclage is that you first have an incompetent cervix. So the incompetent cervix means that the cervix starts to dilate before you're ready to have a baby. Okay. It's usually, honestly, unfortunately, very early on. And usually not only is the cervix trying to dilate, it's also shortening. So one of the things that happens is your contractions, what your contractions are designed to do is to not only dilate, but also to shorten the cervix, which is a effacement, and then you open up. And so as the cervix gets shorter and as it's dilating, this creates a risk for preterm birth. So what we will do for certain women is we'll do a cerclage. And what a cerclage is that it's a stitch. It really honestly looks like as if you're stitching like cloth or something. It's a surgical needle with sterile thread, and they basically just stitch it around so it stays closed. And then if you get towards full term, what they'll do is they'll snip the stitch, say at like 38 weeks, and then they'll let you deliver naturally. And that's all a cerclage is. So asking if you can go back to a 9 to 5, it is very, very personal to your pregnancy. Every pregnancy is different, and it's a matter of what your healthcare provider is comfortable with, and I really can't answer that. However, have I seen it? Yes, I have seen it. I have seen women go back very quickly after they've had a cerclage. So usually you have to take like a day or two off, but you need to ask your healthcare provider for sure. So that being said, I had another one that said, can a mother experiencing bleeding due to an incompetent cervix be airlifted to try to save her baby? So this is also an interesting one. I thought about this long and hard. It is going to again be very individualized. So I actually live in South Florida. So where I live, we actually airlift lots of different patients in from the surrounding, like the Bahamas and Puerto Rico and all these other places. That's actually very common. One of the things I used to do is take care of neonatal babies in the NICU who had been airlifted from the islands. We did it all the time because the healthcare here is better than what they have over there. So I haven't ever seen a pregnant woman airlifted, but I can imagine that there could be a reason why they might be able to do that. When you have an incompetent cervix, if we know that you're in early labor, one of the first things we'll do, if you're stable enough, is we'll actually admit you to like an antepartum room. This is a room where you can have pregnant women who are suffering complications. And so these pregnant women that are suffering complications, one of the things we do if you have an incompetent cervix is we actually, so this is a bed laying flat, we actually will tilt you. So we will actually use gravity in our favor to keep the baby in. So this is your head and these are your feet, and we tilt you like this. And you have to stay like that during like your stay. And oftentimes we keep you like that for a long time, a week or two. It's actually very, very hard on a mom. You also will potentially, like we usually do a bedpan and all sorts of stuff in that bed, in that position. We only lift her up to eat and that's about it. So it's really tricky because depending on how far along you are, any bit of being upright can actually cause you to just deliver the baby right away. A lot of people hear that 10 centimeters and they assume that you always have to be 10 centimeters. But the thing is that this is dilation, right? So 10 centimeters is for a regular full-term baby. But if you're, say, 24 weeks pregnant or 20 weeks pregnant, you don't actually have to dilate to 10 centimeters. In fact, some women will deliver only dilating to 4 centimeters. So it's very important to look at the whole picture. When you're talking about an airlift, and this is something that I know from the babies and other patients that we've dealt with, that patient has to be stable. They have to be stable enough to be transported in a helicopter. And that's a rough ride. So you cannot like transfer somebody that's not stable. If with an incompetent cervix, if you start to deliver with delivery, there's a chance of hemorrhage, and hemorrhage is life-threatening bleeding. You do not want to be dealing with a hemorrhage inside of a helicopter. So that's why I would say it's really dependent. Okay. So what's the difference? Merrick, I hope that I said that right. Mara, what's the difference between folate and folic acid? So honestly, these are the same thing. They're one and the same. There's not a difference. The biggest difference is folate is from your food and folic acid is basically a vitamin that you pick up off the shelf, but they're basically the same thing. We need folic acid for a healthy pregnancy. One of the things I always recommend is that any woman of childbearing age should be like taking a prenatal vitamin. So from 15 to like 45, I'm usually recommending a prenatal vitamin. And that's to help ensure that you have enough folic acid. Some people will also, in case you guys have heard it, will need to take L-methylfolate. That is a broken down version of folic acid. For somebody who has the MTHFR genetic mutation, they're not able to process like folic acid the way everybody else does. So usually for that person, we recommend that they are taking not only folic acid, but also L-methylfolate. But unless you've been told by your doctor to do that, there's no reason that you need to do it. What are your thoughts on perineum massages prenatally to help during labor? So I am a big proponent of perineum massages. I actually think that there's a lot of benefit to them. What a perineum massage is, basically the perineum is the skin that goes kind of between the vagina and the anus, okay? And a perineal massage is usually taking 1 or 2 fingers and basically inserting them and then kind of rubbing against that skin. And it's supposed to like basically gently stretch that skin and kind of get it a little bit more supple and not as tight for when you deliver. The idea behind it is it can help to prevent like any type of tears. We have a video on this. I actually think that perineal massages are also something that partners can be involved in. So partners can actually help with this. You can ask your partner to come with you for one of your later like prenatal visits, because you're not going to start this until like 37, 38 weeks, right? And so you can actually have your OB or your midwife show your partner how to do it and demonstrate it. And then that's one thing they can do for you, because it is hard to like do that yourself when you get a big giant belly. Okay. Now, the biggest thing with perineal massage, you've got to touch your vagina, right? And you are at risk for an infection if your hands are not clean. So you want to do good hand hygiene, and you may even want to use a glove. But if you use a glove, make sure that you have lube, which they're going to tell you to use lube anyway. So it's very important to make sure you're lubricated, because if you're not, it's just going to make it hurt. But your hands need to be clean, or you can cause an infection. In the hospital, one of the things that the midwives will do when they're like trying to deliver vaginally is they will do that perineal massage as you're pushing. And we usually use mineral oil. That's what we usually use for like a natural lubricant. So yes, I think perineal massage is great. It doesn't always prevent a tear, but it's certainly a very natural homeopathic way to try to prevent a tear. You're welcome, Mara. I'm glad that that helped. Any of you joining me, please feel free to put your questions into the chat. So I had a question on bleeding. I'm a week late on my period and took 3 tests, all positive. I've had light and dark bleeding on and off with mild cramps, unlike my usual period. Am I really pregnant? This is my first pregnancy, so I didn't bleed with it. So this is a tricky question. I get a lot of questions on bleeding. Mara, I don't, and I probably should. See, I love it when you guys suggest stuff, because this gives us ideas that we may not have thought of. And so, Mara, I will add that to the list, because I think that's probably a pretty good video. I'm pretty sure I don't have one. Not that I remember. I got a lot of videos out there now. So I will add that to the list. My producer, who's sitting right next to me, AKA my husband, just shook his hand and said, no, we don't have one. So we will add that to the list, because that's a good one. And I can also talk about L-methylfolate in it. Back to bleeding, which can lead to anemia. So when you get pregnant for the first time, sometimes your body doesn't realize you're pregnant, okay? And you may actually have your first period, or sorry, you may have a period during your first trimester, because it doesn't understand what's going on. So sometimes women will take pregnancy tests and they will also have a period or other bleeding. You can bleed because of rough sex, because the hormones for pregnancy thin out the tissue of the vagina, and it can actually make it easier for you to have like tears. You can also have different types of things going on, like a subchorionic hemorrhage, which is a little bleed under the placenta. So there's a lot of different reasons why that can happen. But of course, one of the things we also worry about is miscarriage. So with miscarriage, a home pregnancy test is kind of tricky. So the home pregnancy tests are testing for HCG, human chorionic gonadotropin, which is a hormone that is present during pregnancy. It is found in your blood and in your urine. But when you take a home pregnancy test, which is the urine, it's only measuring, is there some or is there none? That's it. It doesn't measure a level, nothing else. When we think that a woman is having a miscarriage, we will often do the blood test. So you do a blood test, and then 3 days later, you do it again, because in a healthy pregnancy, that number should be going up. And if the number is not going up or it's going down, that is most likely a miscarriage that's happening. But the thing is, and this is really unfortunate because it really confuses a lot of women, and it's very hard to conceptualize. But once we've determined a miscarriage is happening, where you will see bleeding, red, brown, and all the other colors, okay, you can still test positive on a pregnancy test. Because remember, there is still HCG in your system. The HCG is decreasing. And so, therefore, you could pee on a stick and it will show positive. So, really, the most definitive thing to tell you what's going on is those blood tests and checking to see if they're getting more and more as time goes on. It's very important to know what you're looking for with bleeding. We have a video on the colors of bleeding, but brown is usually old blood. Red, whether it's dark red or bright red, that's like a active bleed. And then we have like pink, which is usually like spotting, and it's usually mixed with some other kind of fluid. So those are all kind of the different things. And it's important to know so that when you're talking to your healthcare provider, you can describe it. And then healthcare provider, anytime you see bleeding, you need to call your healthcare provider. Now, in the first trimester, there's a lot of reasons you might bleed, and it would be normal, okay? That it could be very normal. But you still want to make sure that you talk to them about it, okay? Because that's what they're there for. They'll probably bring you in to do an ultrasound to see if they can figure out what's going on. But in the second trimester, we don't like to see bleeding. Okay. This is where there's almost no reason for it to be normal. And we want to see you because depending on where you're at in your second trimester, there's a good chance that if we get to a bleed early, we can fix the problem. And, or if we realize you're going to deliver early, we can try to prevent your delivery to get the baby as big as possible. So second trimester is a very big deal where you want to make sure you're calling your healthcare provider. And then one last thing about bleeding. So let's say you go to the doctor first, second trimester, whatever it is, and you've been bleeding and they take a look at stuff. They do, ultrasound and whatever, and they determine that you have a urinary tract infection that gave you a little bit of a vaginal infection, and that's what's causing the bleeding. So they give you antibiotics. And a couple days later, so your bleeding resolves, and then a couple days later, you start bleeding again. You need to call back and ask the healthcare provider what to do, okay? You don't just ignore it because you think it's the same thing, because that is a big mistake some women make. What they do is they think that it's got to be the same thing and it's something completely different, and then we miss a diagnosis that could be there. The other thing is, let's say you have red blood, and then it goes to brown blood, which, like I told you, brown blood is a sign of old blood. It's usually a resolving bleed, right? So you go to brown blood and then back to red blood. Where red blood's an active bleed. That kind of change going backwards, not a good thing, and you want to call your healthcare provider. They are paid to be your provider 24/7. That is what they signed up for. And so don't feel bad if it's 2 a.m. And if you're not sure, it's okay to go to the hospital and get checked out. You will always be better off to know everything's okay than after the fact wish you could have done something different. So speaking of blood tests, other than CBC and STI, are there any other labs a provider should order? Well, that depends on who you ask. No, they really don't. In the beginning, they do like the standard STD testing, and they'll do and STD testing is usually, at least in the US, is like basically mandated by law. They have to do it on everybody. They can also do like a CMP, which is a complete metabolic panel. And that tests for your glucose. It also tests for kidney, liver, and some electrolytes. Now, that being said, I personally think there should be a lot more labs done. One of the things that's been linked to miscarriage is vitamin D deficiency. And I actually had the unfortunate thing happen where I had a patient come to me and I tested her vitamin D. Her OB didn't. She was already pregnant and her vitamin D level was awful. It was 10. And unfortunately, she had a miscarriage. Whether that's what caused it or not, we'll never know for sure. Her OB didn't want to treat the vitamin D after we had found out the number. Again, I don't know why, but they chose not to treat. But as soon as she had actually healed from her miscarriage, I started aggressively treating her vitamin D to get it back up. as quickly as possible because it was way too low. And she's actually pregnant and she's going to give birth in like a couple months. So, who knows? Was that it? Not sure, but it's definitely important for a healthy pregnancy. So I think vitamin D should be tested. B12 and folic acid, in my opinion, should absolutely be tested. So B12 is and folic acid, these are like the food for your cells. And so it's really important that these are in normal range. Like we said before, folic acid, it prevents birth defects and other things. And so, for example, if you're taking a prenatal vitamin and we test your folic acid level and it's bad, that means something's wrong with how you absorb food. And then what other nutrients could be bad because of that? B12, again, very important for cellular health. It's also important for your thyroid. A lot of people don't realize that B12 is important for good, healthy thyroid hormones. Speaking of thyroid, they should do a thyroid panel on you because you need to make sure that you know if your thyroid is healthy or not. I think in some ways the thyroid is the most important organ in your entire body. What people don't realize is the thyroid controls like everything in some way, shape, or form. And so if your thyroid is out of whack, it can be a very big deal. It can also actually cause thyroid issues with the baby. So that's something a lot of people don't know. The last one that I think should be checked, and it's like never checked, is ferritin and iron storage. So a CBC, they're looking for anemia, but it's front end anemia. It's not back end anemia. And so what I mean by that, it's like what you have currently in your blood. And they're specifically looking at hemoglobin and hematocrit, and they're looking to see that that's normal. But back end anemia, in my opinion, is the more important. So if you guys have ever seen your own blood work, there's a couple things on a CBC. There are MCH and MCHC and MCL or MCB, something like that, right? I don't even remember their exact names. It's like mean corpuscles, something or other, right? Have you ever noticed sometimes if they're wrong? A lot of people, those will be low. And what does your healthcare provider do? They'll be like, don't worry about it. It's nothing. Don't worry about it. Those numbers, when they're low, 9 times out of 10, your ferritin and your iron storage is low. So ferritin and iron storage is representative of what you've got in your body to use when you need it. Ferritin deficiency can cause restless leg syndrome and nightmares. A lot of people don't realize that, but women who start having nightmares, say in the second trimester, are 9 times out of 10 ferritin deficient. The way we treat ferritin deficiency is with iron transfusions or iron tablets. Ferritin deficiency can cause fatigue, brain fog, concentration issues. It can cause memory loss, all sorts of stuff. Energy. Oh my God, so bad. So I test ferritin levels like all the time because I'm in psychiatry. If somebody's coming in and they're telling me either one, they're having trouble sleeping because they just feel like off, their body feels like restless, or two, they have depression, then I am definitely checking their ferritin level to make sure that they aren't having this ferritin deficiency or like iron deficiency anemia. Okay, how does someone go forward if they have an incompetent cervix to get pregnant and avoid this happening again? So, movie mode, that's actually a very good question. And it's really, unfortunately, there is no good answer. This is what I will tell you. If you've had one incompetent cervix, you are at risk for another one. However, it doesn't mean it's going to happen, but you are at risk. So that's considered a high-risk pregnancy. So once you've had one incompetent cervix, they are going to make sure in your pregnancy that you're seeing a maternal fetal medicine physician or perinatologist, depending on where you're at. These are the high-risk OBGYNs. So you'll have your regular OB doctor and you'll have this high-risk doctor. And these high-risk doctors specialize in all of this stuff, including giving guidance on whether it's like if you have an incompetent cervix, whether you should have a cerclage or not. We don't use a cerclage all the time, and there are risks with a cerclage. One of the other things that's been used for years and years is progesterone. Progesterone was used for the longest time to help prevent preterm labor. and to like help prevent like this incompetent cervix. The data is now coming out that it may or may not help, but I see some providers who are using it and some providers who are not. So that may be something else. The only other thing they might do if they suspect an incompetent cervix or you're at high risk is you may be put on bed rest very early into the pregnancy. And what a lot of people should know is that bed rest is not necessarily good for you. In fact, it comes with a lot of risks. A lot of people hear bed rest and they think it's going to be the best thing for their baby and for themselves because they're going to be taking it easy. But bed rest actually what it can do is it can actually put you at risk for pneumonia and for blood clots. So pneumonia is because we need to like walk around to expand our like our lungs. If we're not walking around to expand our lungs, it's going to cause you to have like secretions sit at the bases of your lungs, and it's going to be very detrimental for you, right? Now, the other thing is the blood clots. So your blood contains more clotting factors during your pregnancy because when you deliver, you want to prevent a hemorrhage, right? So after the placenta detaches, your placenta is full of blood vessels, and this is open blood vessels on your uterus. So when the placenta comes off, these blood vessels need to clamp down. And if they don't, you're going to potentially have a life-threatening bleed. When you have these increased clotting factors, it's going to make this job easier because the blood's going to clot faster. So, but in the meantime, this puts you at risk for clots. So this is why they tell you to, when you're taking like a car trip or a plane ride, you're supposed to get up and walk around every hour to 2 hours, is to help prevent that. So that's why we do it. So the reason why vaginal like progesterone works is that it basically is designed to like thicken the uterine lining, and it helps to like keep the like cervix healthy. Again, it's not, the data is starting to come out that it's not necessarily like accurate, like not accurate, that it's not actually helpful. It's not harmful. It's not helpful. It's one of the hormones you need for pregnancy. So it's definitely boosting that. I am not a particular fan of progesterone for two reasons. One, a lot of people don't use clean technique. So progesterone is often used as a suppository. So you have to stick it into the vagina, and people don't wash their hands. And I know that sounds gross, but that's actually what happens. Let's just be real. And that can lead to infection. The other thing is progesterone. Oh my gosh, it is so bad for your, no, it's not bad. It makes your mood so erratic. You go from happy to sad to like, you're just erratic. So it's really very hard for women sometimes to navigate that because the mood swings are so crazy. And I know a lot of women who will try to use progesterone more than once because they have a history of miscarriage. Again, it's trying to thicken the lining and just make the uterus and the cervix very nice and healthy. But they have a couple miscarriages, they've used progesterone and they choose not to for future pregnancies because they can't deal with that kind of stuff. With my last section, I was told I had a lot of adhesions, telling me to avoid another pregnancy. Any suggestions to release them? There is no way to release these adhesions. Adhesions are basically scars. They're scars from your previous surgeries, and they attach themselves to different places, including like in your abdominal cavity. There's no way to get rid of an adhesion. It's there. And unfortunately, it's not going to go. Adhesions can actually also lead to an increased risk of placenta accreta, increta, and percreta. So accreta, I'm pretty sure, is the one, basically one of them goes into the uterine lining. This is where the placenta kind of gets inside the uterine lining. The next one penetrates like to the edge. And then the next one actually comes out and it like attaches to like organs, kind of like endometriosis. These three types of placental attachment are extremely dangerous. Usually when women have this, we have to do a special C-section, and there's a very high probability of having a hysterectomy, because when you have these type of placental attachments, what happens is when that placenta comes off, there's still placental tissue here, and you can't, the uterus can't contract down. So you end up bleeding and bleeding and bleeding. Okay. So that's why these are dangerous. And these are caught, you're at a higher risk when you have scarring on the uterus. So I wish I could tell you that there was a way to do it, but there's nothing. It's internal. There's nothing that can be done to fix that. I had a question. This is my last question from the videos, but if you guys have anything, please put it in the chat. I had a question on my birth control video. So it said, my baby's over 6 months old. Can I still use the 35 microgram progesterone only pill as birth control instead of changing to another method? So I put out a video on birth control because it's very confusing after you have a baby to like, I hope that answered, Mara. It's very confusing for you to like figure out what birth control you're going to use. And it is really important to use birth control, guys. Like, you can get pregnant with methods like natural family planning. You can still get pregnant. You can get pregnant off of the pull-out method. This is a very common one. I had 9 unintended pregnancies last August from the pull-out method. These things are not foolproof. I'm not advocating for birth control. I'm just saying it is a higher probability of preventing pregnancy. So we use the progesterone only pill to help with lactation. If you're going to breastfeed, that's what we want. We don't want estrogen that messes up your breast milk supply. So a lot of women who want to go back on the pill, that's what they're put on, some progesterone only. It's birth control. It's going to work just the same as anything else. As long as you take it as you're supposed to, progesterone only is perfectly fine. And if you're tolerating it well, please continue to use it. There's no reason to switch it. For those of you guys who aren't sure how to take birth control, this is actually very important. A lot of people don't take birth control the right way. So some women are lucky. They can skip a day, they can take it all over the place, and they won't get pregnant. But there are many women, if you've ever heard of somebody who gets pregnant on the pill, we all think, oh, she just wasn't taking it right. No. There are some people who are so sensitive to the hormones that they have to take it at the exact same time every day. If they do not, they can ovulate. The other thing a lot of people don't take into account, which is very important for any medication you take, if you are taking birth control and in the middle of the month you get diarrhea, you should consider that the birth control is not working and that you should just go ahead and use some other form of protection for the rest of the month. Okay. This is very important. If you think about it, if you have diarrhea, everything that's coming through your system is going through fast. And so the stuff that's going through, it doesn't get absorbed the way it should. So birth control, if it's not absorbed, if you miss a day, you are at higher risk for getting pregnant. A lot of people don't realize that. Now, the other thing is there are a lot of medications that will make your birth control pill no longer work. A great example are antibiotics. A whole bunch of the antibiotics make your birth control pills completely ineffective. One of the other things is in my line of work, I prescribe mood stabilizers, which also are epilepsy medications. And a lot of those will also make your birth control ineffective. There are also some stimulants that will make your birth control ineffective. So it is very important that you guys know what you're taking and what its effects are on your body and the medications that you are taking. Mara, I love it. Thank you. I'm glad you're enjoying it. Tonight's is better night. Some nights are not so good. You should see the COVID video. So I don't have any more questions. I am going to say goodnight to you guys, but I promised you that I would tell you what tomorrow's video is. Remember, like and subscribe to the channel. Subscribing helps me out. That's why I'm a part of the YouTube health platform, because you guys all subscribe to me. So like make a whole bunch of accounts and subscribe some more. Please share the channel with your friends and family. Hit the notification bell and you will find out when my videos come out. And tomorrow's video is how to interview and what questions to ask a pediatrician. So it's a big deal. You have to find a pediatrician for your baby. And it's so important that you make that right decision. So tomorrow's video is about interviewing a potential pediatrician to take care of your baby. I'm going to say goodnight to you guys. I'm Dr. Samantha, the maternity mentor. I'm so grateful that you guys are here. I love that you're on here. Please continue to ask questions on the videos. We will be back next Monday at 9 p.m. Eastern Standard Time. Thank you so much. Bye for now.